Hello, my name is Jonathan Davidasa, and together with my colleagues Tania, Laura, Paula, Anna, and Dayana, we will talk about anesthesia.
How is anesthesia issues today compared to the past?
According to history, anesthesia has always been present in human life. Before anesthetic used to curtail poppy, mandrake, and alcohol, although nowadays they are no longer used.
That is, they are made from a combination of local agents, inhalers and intravenous, in order to find a precise balance to perform surgical procedures.
Just to clarify, in the past they used it to perform surgeries open to the public in order to entertain. Who made the was a Scotsman named Robert Liston.
As my partner has said, various anesthesia has been present inside the beginning on history. That is, we when making a comparison, can be said that the acid anesthesia was not as effective as the modern one.
Science at that time or ancestor preferred to die before if they are operated, a case that currently does not exist. 3. What are the principal features and kits of this drug compared with others?
Anesthesia is divided into three main categories: local, regional, and general. Of then affect the nervous system. In some way can be administered to various methods and different medications.
Local anesthesia, it only acts on a small part of the body, applying an anesthetic drug to avoid pain.
The general anesthesia objective is to leave the person completely unconscious and keep them in this state during the operation.
Regional anesthesia. The Nulli Mason is inject near a group of nerves and not alert area of the nerve.
From my point of view, I think general anesthesia in the details on the three times and in third local anesthesia is the less risky.
It should be noted that three had certain complications, such as local anesthesia is used to perform catheterization. Signs be not sleeping, the patient leaves him catches to breathe. One complication signs the heart in one of the most important organs for the human being.
On the other hand, there's in the journal anesthesia, which when performing and surgery that implies that your body is calm on while being able to move.
How is it used and why?
The anesthesia is the medicine that keeps you from having pain during certain medical procedures. These medicines are called anesthetic. They can be given the injection, inhalation, or intravenous.
The type of anesthesia you receive depends of the procedure and your general health. It is important to mention that anesthesia use drugs or other methods to produce loss of consciousness and block the sensations of pain.
Increasing the comfort and safety on the patient during nasal procedures. On rarely do some patients recall event.
Recall it be dangerous or risky. A person it would set going into surgery are risky and this increase with the application on anesthesia, but if anesthesia were not applied, the surgical process will be too painful and the surgery score not be performed.
According to doctors, anesthesia is safe, but there might be different side effects such as breathing problems or an allergic reaction. On the other hand, side effects and serious allergic reaction due to anesthesia are not very frequent. However, some symptoms of anesthesia have been evident, such as nausea, vomiting, dizziness, and headache.
In some obligate situation, it is evident if there is excess analysis. The person may not about the wake up from the surgery. Pardon.
I believe the surgical producers get better as science advances and it get to know in a correct way the functioning of the brain mechanism that achieves the anesthetic effect. Also, the current anesthesiology producer is either and more reliable than the old ones.
To conclude, it needs to be take in account that the previous that anesthesia uses to use infrequently. And now these modern times, its most purpose is to hold on pain.
But depending of the type of anesthesia used, in addition to anesthesia, those effects will occur sensitive in the patient. Thank you.
Thank you very much.
Thank you very much.
Thank you.